Here comes the educational part of the program here. Tinnitus. Have you heard of tinnitus? That ringing in the ear. I have a friend of mine who suffers from this, and I'm really interested in gaining some knowledge and some education about it. I have an audiologist with me now. Dr. Abigail Sweeney joins me once again. Dr. Sweeney, welcome back to the show.
Thank you so much for having me.
Yeah, tinnitus. You probably talk about this a lot. So for those who are not familiar or do not have a loved one or a friend who has tinnitus, explain exactly what is it?
Yeah, so tinnitus, as audiologists
oh, is that right?
call
I'm sorry.
Well,
Tinnitus.
it's like potato, right?
Okay.
So I call it tinnitus. So tinnitus is any type of ringing or noises in your ears that are not produced by an external sound source. So a lot of people will say, I have ringing. They'll say, I feel like I can hear crickets in my ears, cicadas. We even have people say that they can hear, it sounds like the ocean in their ears. So there's all kinds of different descriptions of what people hear. So it's not just ringing, there are other kind of manifestations of tinnitus. So it's really genuinely any kind of noises that you hear in your ear when there's no other external sound source.
So what is the cause of tinnitus? Is it, I've heard everything from perhaps someone was in a situation where they're around loud machinery or I've heard other times when people are just born with this. What's the possibility?
Yeah, so there are a lot of different causes of tinnitus, but the number one cause is hearing loss at one or more pitch or frequency. So that is why we, as audiologists, know a lot about tinnitus because a lot of our patients do have it. So in terms of the hearing-related type of tinnitus, it really is damage to that hearing organ. And so what happens is when you hear a sound, all sound is vibration, right? So a sound wave actually travels down.
Show us that.
Yeah, so this is our big ear here.
Face that camera there, if you don't mind, Dr. Sweeney, and show them what we're talking about. Yeah,
okay.
Yeah, you can hold right there.
Okay, so this right here is our external ear. And what happens is a sound wave will travel down that external canal there, and all sound in, again, is vibration. So as that sound wave moves down the ear canal, it actually vibrates this eardrum here, and that's a mechanical energy, which then causes these ossicles, which are the three tiniest bones in your ear, in your body, actually. It causes those bones to vibrate. That mechanical energy then transfers to your hearing organ. So this is your hearing and balance organ actually right here. The actual size of the hearing organ can actually fit on the tip of an eraser. So it's a very, very, very small. But inside of this hearing organ, the snail-shaped organ here, are little hair cells. And so what happens is as that energy travels to the hearing organ, we have our hair cells that move back and forth. So as they move back and forth, that's an excitatory position. It sends a signal to your brain that you're hearing a sound. Now, when there is no sound present, your little hair cells are standing straight on end, like in this picture. So these are healthy hair cells. So what happens over time with damaged hair cells due to genetics, environmental factors like noise exposure, medications can even cause, hearing loss and tinnitus. What happens is these little damaged hair cells become kind of displaced. Sometimes they get stuck in this position. Well, that position is the excitatory position. So what's happening is your ear is sending a signal to your brain that there is a sound present when there is no external source causing that noise. So the brain is a very active organ. It's always trying to make sense of things. So if you think about it, like if at night, all of a sudden you hear a sound, you're in your bedroom and you hear a sound in the basement. What happens? You get your fight or flight mode kicks in, cortisol kicks in, and you're like, where in the heck is that? Like, what is that? And so that's kind of what the brain does all day long with that tinnitus, because the visual system cannot rectify what the auditory system is telling it.
It tells you a lot about the connection between the brain function and your hearing, which is, okay, so I guess the next step is what kind of treatments are available? What can be done?
Yeah, so the great thing about tinnitus is if it is hearing related, like pain is to a cut, tinnitus is to hearing loss. So it's a symptom of the main problem, and the main problem is the hearing loss. So many people with hearing loss, about 80% of our patients get great relief from being treated for their hearing loss. So by wearing hearing instruments is our #1 kind of treatment option for tinnitus. And people genuinely do get a great relief. We sometimes will turn hearing aids on in the office for patients, and they immediately go, oh my gosh, I can't hear it anymore. So it really is remarkable. Just by bringing kind of that sound source, you know, like those external environmental noises that they can't hear because of their hearing loss, loss, it brings a clarity back to their world, so the brain is more interested in listening to that, and it kind of puts that tinnitus to the background.
You need to talk to Dr. Abigail Sweeney if you know someone who suffers from tinnitus. Okay, with the time that we have remaining, I want to talk about, because I'm interested in lyric. There's a lot of folks out there who have hearing issues, but they don't want to appear elderly, and they're like, okay, I don't want to have a noticeable, you know, hearing device. This would answer that, right?
Yeah. So Lyric is really awesome. What Lyric is it's actually 24/7 hearing. With traditional hearing instruments, you actually take them off at night. With Lyric, you wear it all day long and all night long, so 24/7. It's kind of like a contact lens for the ear. So the audiologist will sit this device 4 millimeters from your eardrum, and because of how close it is fitting to your eardrum, it is more natural, and it also is kind of fuss-free, so you don't have to worry about changing batteries. There's nothing you have to do with it. We put it in the office, and then it gets changed out about every 3 to 4 months.
Wow. So if people are interested, they can come see you, right?
Absolutely. And the great thing about that in relation to tinnitus as well is because a lot of times when people are falling asleep at night, their tinnitus is really loud and kind of prominent. So the great thing about the Lyric is because it is 24/7 hearing, it really helps those people with tinnitus at night.
I can't emphasize this enough, though, as far as there's so many aspects of hearing that can enhance your life. If you're hearing well, if you're going to an audiologist like Dr. Sweeney here, and everything is 100% go, you're more social, your brain is functioning at full capacity. I would imagine you're sleeping better. There's so many, I guess, ancillary benefits of making sure that your hearing is 100%, doctor.
Absolutely, absolutely. Yeah, I mean, the comorbidities of hearing loss are pretty extensive. And so people who have untreated hearing loss are more likely to have dementia, actually cardiovascular disease, they're more likely to have diabetes, they're more likely to have depression, anxiety. So there are a lot of things. I have this really cool poster in my office, and it says the hearing bone's connected to the ... and it's got all the different systems that are connected to and related to hearing loss that it's so important. And I do want to impress upon, you know, the viewers as well, is that if you do have tinnitus, besides hearing loss, there are other important medical problems that could be occurring, and that is what's so important not to ignore it and really to follow up with a hearing healthcare professional.
Oh, man, it's really good information. I wish we had more time.
Yeah.
And it's interesting, too.
Yeah.
Okay. Again, education is power. Dr. Abigail Sweeney has been a great source of information. Give them a call today. The importance of hearing, I think she's made it very evident, and it's crucial. There you go. There's the information on your screen.